Hello, everyone. Thank you for joining us for the second attempt at our ADHD in girls webinar. In my own ADHD moment, I did not press record on our webinar last time we gave it live. So thank you so much to those of you who joined us live. Now you get to see a slightly different version of it as we talk off the cuff again this time. Um, Anyway, I am Dr. Mandi White-Ajmani. I am the owner of Small Brooklyn Psychology. We are a group psychology practice at Industry City in Brooklyn, where we offer therapy and neuropsychological assessment to people of all ages, all backgrounds, and all psychological concerns. I am joined today by Dr. Megan Moxey, who is going to lead this webinar in a few minutes. You can see the rest of our clinicians there at the bottom. That's me, that's Natasha Brown, Rebecca Abbott-Sinclair, Sam Janeet, Maddie Lawler, Nav Gill, Cecilia Barbosa, there's Megan Moxey, Ben Janitis, Olga Fuller, Amira Hanna, and Danielle DeFilippo. We are all psychologists and therapists who have lots of training in working with people across the lifespan, but we also have special training and experience to work with children and parents using evidence-based assessment and treatment. Now, one of my goals at Small Brooklyn has always been to be a resource to the community. Whether you work with us directly or not, it's really important to us to be able to share the information that we have and really help connect you to good resources so that you're getting lots of good science-backed recommendations to help your children and families. One of the ways that we do this is through these webinars with our long-term partners, Park Slope Parents. Park Slope Parents are definitely the originals in helping to get good supportive information out to families in Brooklyn. So if you are not a current member of Park Slope Parents, I highly recommend it. Even if you don't live in Brooklyn, they have so many resources and connections to great information. We have actually developed a lot of these webinars across a whole lot of different areas of psychology, from tips on managing behavior at home and in a classroom, to what a neuropsychological assessment is and how it helps, to how to understand mental health issues in children and adults, how to take care of yourselves as parents. All of these different ideas and information are available in our talks that are available for free on our website at smallbrooklyn.com/services/talks. So now we're going to turn and talk about ADHD specifically. So Dr. Megan Moxey is here. She's been leading this webinar. She's sharing her clinical experience and her research findings on ADHD and how it specifically presents in girls, and especially girls of color. To introduce her formally, Megan Moxey is a clinical psychologist and finishing up her postdoctoral fellowship with us here at Small Brooklyn. She specializes in providing evidence-based treatment to children, adolescents, young adults, and parents. She earned her BA in psychology from Adelphi University, her MA in clinical psych from Columbia University, a teacher's college, and her PsyD in clinical psychology from Long Island University at CW Post. Megan has worked in many different settings, including hospitals, community mental health clinics, therapeutic day schools, and now in private practice. She has extensive training in many evidence-based practices, including cognitive behavioral therapy, which is CBT, behavioral parent training, supportive parenting for anxious childhood emotions, which is SPACE, parent-child interaction therapy, PCIT, dialectical behavior therapy, DBT, and exposure and response prevention, ERP, which is a common treatment for OCD and phobias. She also has experience in school-based consultation, classroom management support, and teacher consultation. She works with clients who have anxiety, OCD, depression, dysregulated behavior, adjustment issues, attentional difficulties, suicidality, and self-harm. In addition to her work with children, Megan works with parents to help them learn effective ways to manage and support their child's social, emotional, and/or behavioral difficulties. So, with that very impressive pedigree, Megan, please tell us what you know about ADHD in girls.
Yes, of course. Hi, everyone. So before we begin, I wanted to go over an agenda. So first, we're going to do an activity. It's more like an ADHD simulation where we're going to see what it's like inside of an ADHD brain. Then we're going to go into understanding ADHD and the different types of ADHD. Then I'll go more into understanding gender and ADHD, how to obtain a diagnosis for your girls, different treatment approaches for girls with ADHD, a summary of my research on ethnic minority girls diagnosed with ADHD. Then we'll learn some ways on how you can support your daughters at home, some resources, and then we'll have our Q&A portion. So we're going to dive into the activity here. And so we'll watch it for a little bit, and then I'll ask you some questions after. Okay. So I know that was probably a lot to take in. So first, let's do some questions to see if you're able to catch any of that information. So, who decided to go shopping? If you guessed John and Mary, you'd be correct. What color are Mary's eyes? They were blue. What bus number did John and Mary take to the supermarket? Number 47. How far did they walk to the supermarket? 50 yards. How many pints of milk did they buy? They bought 4 pints. Who received the change at the cashier? That was John. Did they buy dog food? Answer is no. And what street do John and Mary live on? Tyndale Square. And so I imagine while completing this exercise, it was really hard to focus on one thing at a time, even focus on the activity, which is going shopping, because there are so many things going on. Did I eat lunch? Oh, that noise. Oh, the telephone's ringing. And there are so many different types of noise coming into their brain. So this is exactly what a lot of kids with ADHD typically experience. If not all experience this, where they're overwhelmed by so many things that are occurring around them, then it's hard to focus on what's actually happening in the moment. And so while you may tell them to do X, Y, and Z, like pack your bag, get your stuff ready for school, they are thinking about what they're going to have for lunch. Did my homework? Did I brush my teeth? And then they're going back and forth trying to figure out all these different things. And it's hard for them to even remember what you asked them. So it's always important when you're talking to kids with ADHD to really make sure you have their attention, eyes on them, and they have their eyes on you and you're close by and not shouting directions. And we'll talk a little bit about that and how you can support your girls at home. Let's not do that one again. So we're going to focus on just giving an introduction to understanding ADHD. It's one of the most prevalent disorders of childhood. It's often defined as being really pervasive, impairing, really persistent, and it showcases developmentally excessive levels of hyperactivity, impulsivity, and or attention. And in the US, it's noted as one of the most common reasons for clinical and educational referrals. And you'll see in the next slide why that is the case. And so 9.4% of children and adolescents are diagnosed with ADHD, which is a large portion with a 5% global prevalence rate. So it's very heavily diagnosed around the world as well. Boys are 13% more likely to be diagnosed with ADHD compared to girls, and girls are 5 times less likely to receive a diagnosis and treatment of ADHD, which we'll be diving into today so we can learn more about why this is and how we can recognize the symptoms on girls, and so you're able to obtain a diagnosis and effective treatment for your daughters. And so I think it's really important to understand the 3 main categories of ADHD. So we have inattention, hyperactivity, and combined. And so for inattention, hyperactivity, they need to, especially if they're under the age of 16, be presenting with 5, 6 or more symptoms of either inattentive or hyperactivity, and then obviously both for the combined presentation. And for adolescents age 17 and older and into adulthood, they need to at least present with 5 or more of the symptoms of inattention or hyperactivity. And so when we look at inattention, these are the kids that often are struggling to focus in class. They make a lot of careless mistakes. They don't really seem to be paying attention when you're talking to them. They get really easily distracted. They lose things. These are the kids that struggle with organization, which can be seen either in their notebooks, in their backpacks, in their rooms. So these are kids that probably can't find their worksheets or the assignments and or can't locate their socks or their pants in their room. And because things are all over the place, they don't know where they put it. And so it makes it hard for them to find where things are. They often avoid or dislike tasks that require long amounts of focus because they really struggle with that. And then so oftentimes I recommend motor breaks in between to help them get some of that energy out and then help them refocus. Then there's hyperactivity, which is the typical presentation that people typically think about when they think about ADHD. And so they're fidgeting, they're squirming in their seats, they're running around, talking excessively, blurting out answers. So these are the kids that don't raise their hands in class and tend to shout out the answer. They're standing in class and walking around. They really struggle to take turns or wait their turn and often interrupt conversations just to get their point across. And so with gender and ADHD, We have Patricia Quinn, who is a director and co-founder of the National Resource Center for Girls and Women with ADHD. She found that girls and women are more likely to exhibit inattentive symptoms compared to men and boys. And since their symptoms are more subtle, girls tend to don't fit the stereotypical of what ADHD looks like. And so that's why they oftentimes get missed. So in a classroom where there might be boys who might be getting up out of their seat, running around, calling out, being super impulsive, oftentimes the girl that's seen as like daydreaming often gets forgotten in comparison. Girls and women tend to exhibit some of the following symptoms. So forgetfulness, disorganization, low self-esteem, difficulties with socializing, and girls and women oftentimes are better at developing coping strategies than boys. And so this is where the masking component comes in. And so because of this, they're able to mask their underachievement, their performance. And oftentimes they put on a facade that they are competent, which is really difficult for them. So there's different types of masking. There's harmful masking, and then there's some helpful masking, which we'll talk about. So harmful masking looks like purposely saying yes less in a social situation so they're not interrupting people or they're not talking as much, which dims their personality. And then they oftentimes suppress strong emotions, have difficulty focusing because they're trying hard to hide that excess energy that they might have. Also maintaining perfectionistic standards to hide their self-perceived flaws. So they have to do so much, which causes them to feel really fatigued and finding that they're working 10 times harder compared to their peers just to be at the same level, be as successful and on par as their peers. Usually around like middle school or even before that is when they have that increase in academics, extracurriculars, and the social demands. And so with all of that going on, it's hard for them to balance and it seems really impossible for them compared to their peers. And so oftentimes these are girls that are like, why can't I do this? Why is this so tough for me? Why is it easy for this person and hard for me? And so they often question their abilities. Then there's helpful masking, which is when you're using things like tools and timers to help with punctuality, help decreasing procrastination by adopting organizational strategies. And we'll talk about how to help girls incorporate these things to help them be successful without putting so much pressure on themselves. And when girls are left undiagnosed, oftentimes they're unlikely to receive the school supports and accommodations necessary in order for them to be successful in school. They are also more likely to engage in risky behaviors such as substance abuse, promiscuity during adolescence, and also into adulthood. They also have a higher rate of depression, anxiety, and eating disorders. Oftentimes have an increased low self-esteem, this is when they, like I shared, question why they're unable to succeed like their peers and have a lot of those automatic negative thoughts. And I'm not good enough. I'm not smart enough. Why should I even try? I'm going to fail. And because of all these negative thoughts, they're also at a higher risk of self-harm and suicide. And so these are some additional reasons as to why ADHD is missed in women and girls. So there's a male bias in research. So initially, ADHD was very much a male-dominated topic of research, solely focused on white males, which did not help us understand how ADHD presents in girls or within minority groups. And then there's the societal standards. Girls and women are expected to be focused, be organized, reserved, take up as little space as possible. And so when they present with these symptoms, they don't often align with societal constructs that are in place for girls and women, which causes more shame than it does for boys and men. And when we think about the different symptom presentation, we discussed that as well as masking symptoms. And then lastly, we have the misdiagnosis of another condition. And so one of those diagnoses that might be they might be misdiagnosed as anxiety. So that's one that can come up pretty often. Okay. So I think it's also really important for us to know how ADHD might impact gender nonconforming children. What's really disappointing is that there are no studies that have been conducted on gender nonconforming children with ADHD. Katie Weber, the founder of the organization Women and ADHD, has done a lot of interviews with non-binary and trans individuals with ADHD. And she found out their ADHD presentation was often based on what gender they were socialized as early in life. And so I definitely think there needs to be more research conducted to get a larger sample size to see that if this is evident with most, if not all, gender nonconforming children. And I think by having more research, it'll give us more insight into if this is something that is occurring for all gender nonconforming children, understand what they're going through, and understand how different or similar their presentation is to what we already know about ADHD. So what's really important is how to obtain a diagnosis, right? Who can you go to? So this is a list of providers that you can go to obtain a diagnosis. It's really important to reach out to any of these individuals if you feel like your daughter might be presenting with ADHD, just to get either her tested, get a diagnosis, and then if interested, medication. And so when you're getting it diagnosed, you need questionnaires completed by parents, schools, or other adults familiar with girls, and also obtaining a neuropsychological assessment and psychiatric assessment. And with the neuropsychological assessment, I'm sure Mandy can speak more to this, but this is really helpful. Not only gives an understanding of how they're doing academically, but cognitively and social and emotionally as well.
Yeah, I'll just break in for a minute to say that um, the criteria for diagnosing ADHD is very behaviorally based. Are you seeing kids who are procrastinating? They are like disorganized in their behavior, in their keeping their materials organized. They're constantly forgetting things, like that kind of stuff. And the problem is that those kinds of behaviors occur in almost every psychological issue that we have. Um, as soon as someone is really struggling with anxiety, for example, they are often also struggling with a ruminative, they're thinking a lot about their worries, which is getting in the way of the sort of planning and strategizing, organizing that they might be able to do in a normal status when they are not anxious. So that's just one example of how executive functions tend to be compromised anytime that you are having psychological issues. So when people see their teens, for example, having trouble with executive functioning, a lot of people immediately think of ADHD without realizing that there might be something else to it: anxiety, depression, learning disorders, autism, trauma, difficult life circumstances in general, relationship issues. All of those things typically start, you sort of know that there's a problem because executive functioning starts getting in the way. It's like a fever in that way. It tells us that there's a problem, but not necessarily where the problem is coming from. So, anyway, a lot of times parents will call us and say, can you just do an ADHD evaluation? Can I just fill out some questionnaires and I'll tell you about the behaviors and you tell me whether it's ADHD or not? And if you were to fill out some questionnaires and say, yes, my child is having problems with organization and can't concentrate and isn't achieving at school as well as they should, you might conclude ADHD without realizing that actually it's one of these other things. So that is just a quick explanation of why we like to do a very comprehensive evaluation, because in a lot of ways, making a diagnosis for ADHD is sort of process of elimination, making sure it's not these other things first before we can say confidently that this is coming from ADHD. Because if you go and try and treat the executive dysfunction, assuming that it's ADHD, you might actually be exacerbating the problem if it's actually coming from something else. So that's just a little aside, because I do get that question from parents quite a lot.
Yeah, that's very helpful. And so basically exactly what Mandy was sharing in terms of what to look out for. We want to make sure that these behaviors that are associated with ADHD often occur more than is typical compared to girls their age, occur over an extended period of time, so at least 6 months, and occur in more than one setting if it's solely ADHD that you are trying to understand if your daughter is presenting with this. And like Mandy said, we want to make sure it's not another diagnosis, so like anxiety, depression, a learning disorder, or a trauma. And so there are different treatment approaches that you can utilize. Oftentimes parents combine a couple of them because they're the most effective. And so CBT, cognitive behavioral therapy, is an effective treatment option for children that teaches them different coping skills and different strategies to really help them self-regulate. And then there's organizational skills training, which is a behavioral intervention that helps strengthen their organizational skills, help them focus better, and improve academic performance. It's one of the ones that is really effective. And there's a NYU has a great study that they do where they get kids and they help them learn these organizational skills. It's called OST. It's very, very helpful. And we share that resource at the end of the slide as well. Then there's parent management training. It's typically an intervention used to treat children and adolescents who are having trouble regulating their behaviors, sometimes showing oppositional, aggressive, and antisocial behaviors. And really, I think it's just an effective technique for all parents to have access to and in their own toolkit because you learn how to be the therapist for your kids. Yes, they can meet with a therapist one to one, which is really helpful. But when they're really young, it's really helpful for parents to learn how to help their kids regulate their emotions. It helps teach you skills and how to improve their behaviors and learn new skills and how to model how to navigate different situations. And I find it to be really effective, and parents learn so much from it. There's also social skills training. It can be done in a one-to-one setting, but I typically recommend a group setting where kids can learn to improve and maintain social interactions, and just learn how to prevent any interpersonal difficulties. Also very helpful for kids who struggle with opening up and talking to new kids. They have this space where they can learn strategies on how to do that. Music and or art therapy, really, really helpful, especially if your kids love music and art therapy. This is a really great way to combine the two. Helps build better focus, self-control, and social skills. And we also have some recommendations for that as well. Then we have school interventions, which is really beneficial because if you're able to obtain an ADHD diagnosis and say that is the main diagnosis they're presenting with, then the school being able to provide those interventions helps them be as successful as they can. So they can get preferential seating, behavior management strategies, which they can either receive through a 504 plan or an IEP. And so a 504 plan provides accommodations without the need for specialized instruction, and they don't need to be updated every year. Whereas an IEP, they're annual and they provide additional intentional interventions through a specialized instructional goals and objectives. I'm sure Mandy can add more to this, but this is essentially the summary of the two of these that I think are really beneficial to know as you're going into deciding what kind of interventions you need for your kiddos. And then we have executive coach, used more for adolescents, college age students, and adults. But this is really effective. Individual coaching sessions that help kids, adults, adolescents learn strategies to help them focus, initiate tasks, manage their time, be able to organize, decrease procrastination, and manage stress, and learn how to prioritize tasks. So it's very helpful for your older kiddos or older daughters and maybe kids that are going to college and learning strategies ahead of that time as pressures increase and workload increase. There's also medication. So since I'm not a medical provider who prescribes medication, it will be really important to consult with your child's pediatrician, psychiatrist, to decide which medication would work best with your child. But I wanted to provide some brief information on the topic. So children can start medication as young as 6 or 7. Some parents typically will start therapy first before incorporate medication, just to learn the tips and tricks and strategies for themselves, for their kids. I find that it's really important to note that the most effective form of treatment, according to research, is a combination of therapy for children, parents, school intervention, and medication. And medication comes in two forms. There are stimulants and non-stimulants. And the medications for help control their individual behaviors, help with increasing their attention and memory, decrease in any hyperactivity, impulsive behaviors. And then there's stimulants versus non-stimulants. So stimulants are things that you've heard of. So the Ritalins, Concerta, Adderall, and Vyvanse. And so the benefits of taking medication, some of the fewer frustration tolerance, increased attention span, decrease in their impulsive behaviors, ability to actually stop and listen and think before they respond instead of reacting. It helps retaining information, even improving relationship with family members, siblings, peers, teachers, and authority figures. Also helps with academic performance and patience. And so the benefit of taking a stimulant is that it's fast acting compared to a non-stimulant. There is a minimized long-term consequences and fewer behavioral and social problems. Then they have non-stimulants, which are like clonidine, guanfacine, and Strattera. These not only help decrease ADHD symptoms, specifically impulsivity and aggression, but they also help to treat tics and Tourette's disorder, and similarly to the stimulants, have fewer behavioral and social problems. And so to dive into my study, which is near and dear to my heart, the purpose of my study was to really understand the experience of parents who are able to obtain ADHD treatment for their ethnic minority girls. And specifically those, when I'm referring to ethnic minority for my study, I'm referring to African American, Black, and Latinx families. And so the rationale for my study was to understand the experience of parents who have successfully obtained the ADHD diagnosis and treatment for their ethnic minority daughters, to be able to generate a theoretical models to help better understand how to retain and engage parents and families of ethnic minority girls with ADHD. My study, I interviewed 12 parents. They all happen to be moms, with 60% of my families being Latinx and 40% being African American and Black. So dive in. Race and ethnicity are important factors when considering to gaining an understanding of the etiology and development of ADHD, because ethnic minority children are less likely to receive an ADHD diagnosis and treatment. And earlier diagnosis, like with girls, decreases their chance of developing more severe symptoms and diagnosis in adulthood. And so in my research, I did a literature review to get an understanding of what are the main barriers to treatment for these families. And these were the four main barriers. So access to treatment. So research found that these families, these children often have limited access to treatment due to their lack of insurance, the cost of treatment, which can stem from lower SES status. While this isn't true about all families within these minority groups, it was pretty common occurrence within the research that I was looking into. Perceptions of etiology of ADHD. So both the families often decline treatment interventions due to a lack of knowledge associated with of ADHD and the stigma associated with mental health in general. Mental health was something that was not talked about. It's very stigmatized. And so being able to increase their awareness and understanding of mental health is also very, very important when obtaining an ADHD diagnosis. And then African American / Blacks trust of medical and mental health professionals. These families often decline treatment interventions because it's usually derived from the stigma of ADHD is usually derived from everyday racial discrimination that they face on a daily basis, and also the mistrust of providers, even dating back to the Tuskegee experiment, where they were not treated in a kind manner whatsoever. And then we have Latinx families' cultural barriers. So these have been found to have these families have been found to have limited knowledge of what the treatment process entails, which may influence their perception of treatment length, speed of recovery, their engagement in treatment. Also, if they're immigrants needing a translator, not having access to that or understanding their family values. And so a lot of this played into a role in why there were barriers to treatment for these two groups. So, while there has been limited research conducted on females and then limited research conducted on ethnic minority children, as you can imagine, there was even finite amount of research conducted on the intersection of the two. One of the few studies that I really loved getting to read and getting to understand was conducted by Wait and Tran in 2010. It was a qualitative study where they interviewed a cohort of 16 ethnic minority women to gain insight into their experience with ADHD and the importance of receiving an earlier diagnosis and treatment. And so in this study, they found that when these women were diagnosed later on in life, it was more like an aha moment for them where they're like, wow, this all makes sense now. Why didn't my parents obtain a diagnosis for me earlier? I think even one woman shared that they were told that they had ADHD when they were younger, but because of the stigma, their parents never followed up with treatment or medication. And so they struggled a lot throughout their life, which is very similar to the other girls, other women in the study, where they struggle with academics, social, either with friends or with romantic relationships, low self-esteem. Many of them, if not all, had depression and anxiety, and they just didn't feel like they were competent and able to. And once they were able to receive treatment, medication, they felt so much better and they felt like they were actually able to take in information and focus. And a lot of them, as you can imagine, got very emotional because like, why didn't I get the opportunity to receive a diagnosis and treatment earlier? This would have changed my life for the better. And so based off reading this research article, it made so much sense to me to really focus on how do we engage and retain these families from an earlier on to decrease the chance of this happening to other women within these ethnic minority groups. And to dive into the results of my study, so I interviewed them, it was qualitative. So that looks like taking what they shared and really coming up with themes and constructs from my study, from their interviews. And so these were the 5 main results of the study. Being a minority impacted their ability to engage in services. There was a dissatisfaction with the professionals, which impacted their decision making about treatment. Having knowledge and supportive resources really helped them gain diagnosis and treatment for their daughters. So some of the parents that I interviewed had a degree and a lot of degrees in like mental health, or they knew people within the field, which helped them attain a diagnosis. Also, the fact that some of these moms were actually diagnosed with ADHD later on in life. So they wanted to make sure their daughters were able to obtain diagnosis earlier on. There was also a limited awareness of ADHD, which made understanding it difficult. Parents often had to really advocate for their daughters in order to receive treatment and diagnosis. And one mom, because she was advocating so much for her daughter learned to advocate for herself, especially in classrooms where she's like, "Hey, I need more time on this test. I don't operate the same way these other kids do, and I'd really appreciate that because my other teachers do that." And so she was able to advocate in a classroom where the teacher was not providing her with the supports and services that she was supposed to get, which is amazing. And through these results, I was able to create that theoretical model to help other families receive effective treatment. So things that providers can do differently, how to help families understand ADHD better through workshops. And my goal is to get it published and really implement this within the community so we can see a change. And then next is talking about how to support your girls at home. So we want to help her understand ADHD and decrease the stigma associated with this. So this looks like telling her this is just how your brain works. We'll learn strategies together so that you can be successful. We want to promote a safe and trusting relationship with them so they can go to you whenever they are struggling. We want to validate her feelings because to her, she may be thinking she's the only one experiencing this. So if we can validate and normalize this for her, that'll really help decrease that low self-esteem and maybe the negative internal dialogue she's exhibiting. We want to maintain realistic expectations instead of putting neurotypical demands on your daughters. Being a positive role model. So showing her what emotion regulation, respectful communication, problem solving, self-advocacy, and resilience looks like. Creating a predictable environment with consistent routines. So if she knows what to expect, she can develop those healthy habits. We want to respond to her in a calm and flexible manner, promote her self-confidence. So that looks like encouraging her to keep trying and also taking risks, showing her that you have faith in her ability to handle things while giving her room to make mistakes as she learns and grows. Also helping her experience fulfillment, confidence, and success. So this looks like finding activities that she enjoys and does well in, finding opportunities to help her develop social skills whenever possible. So you can encourage her to, say, join an after-school activity, so clubs that focus mainly on her interests, group activities that allow for individual space. So doing like art class or a book club, things to help her learn to feel safe and comfortable in a social setting. And then if you have a daughter who's more impulsive and hyperactive, social situations that could be really effective for her are things like sports, track, theater, things that can really help her get some of that energy out. And by learning how to work on a team, will also help with that social aspect as well. And some additional ways to help support more of the like helping her create a routine because structure is so important for these kids. Helping her get organized with her folders, even at home, working well and understanding that she might not be organized to your demands that you might think or the idea you have in your mind, but being okay with like maybe organization looks like organizing certain spaces in her room so she has a clear mind, like her desk is organized, but maybe she's not always organizing her clothes. You want to give her choices to show that her voice matters, be clear and specific when talking to her so she knows what's expected of her. Help her understand how to get things done. So creating a plan for homework and when to study for exams. By teaching these skills when she's younger, it really will help her in like high school and college as well, and just life skills in general. Using goals and praise or other rewards because it's very, very motivating. Use effective discipline such as timeout and consequences. So removal of devices is an example of a consequence that could be very helpful. Using and creating positive opportunities, as well as helping provide a healthy lifestyle. So making sure they're getting ample sleep, and are active so they could channel their energy, getting to eat well. So those are some examples of how to support your girls at home. Then we have resources for parents that I shared earlier. We have the Duke Center for Girls and Women with ADHD. Um, we have the NYU Organizational Skills Training Study for elementary school age children. We have Chad for women and girls. Child Mind is really helpful. Then Social City is a social skills group. And they have multiple times and days available. And they have what's known as like boot camps, which is just a shorter form of their long-term social groups that they hold. And then there's different Facebook groups. I shared this one, but when I was doing my research, there was an enormous amount of support and support through Facebook groups, and you can either find it within your community or just worldwide. And the support that these moms and dads are receiving within these groups it was incredible to witness. Because with one mom might be struggling with, one mom might suggest suggestions or resources or providers that they can utilize, and it was such a supportive environment. And then some books that I think could be really helpful. Understanding ADHD in Girls and Women, How to the ADHD Parenting Guide for Girls, and then one for girls in general, like younger kiddos. So My Busy, Busy Brain, the Kaizen Method for Parenting the Defiant Child. Again, very helpful. It's the PMT that I was sharing earlier. Then there's also Smart but Scattered, the revolutionary executive skills approach to helping kids reach their potential. So these are just some resources that we have available. I'm sure there's so much more than this, but these are the ones that I tend to share with parents. And that is the end of the study. And if you're looking for more support, we're here to help. If you're interested in learning more how we can support you and your family, this is our email that you can contact us at hello@smallbrooklyn.com.
Thanks so much, Megan. That was awesome. Again. All right. So I'm I'm just gonna keep apologizing.
It's okay.
So we're going to go through some of the question and answers. I know that was also really helpful for the participants. So some things we're going to ask again, and then other things we'll actually have a little bit more time to get into some questions we didn't have a chance to do last time. So let's start by talking about some difficult to catch cases, let's say, or maybe cases where the question of ADHD is pretty mild. And we want to be able to help these kids as much as possible, even if they are not like ringing people's alarm bells. So you have kids who are maybe procrastinating a little bit, or kids who have to work super hard by masking, like you said earlier, and then they are like working so hard under the surface. At the end of the day, it's maybe taking them like 3 or 4 hours to finish their homework at night, but they are, when everybody else is only doing like 1 hour, for example, but they're turning their stuff in, and they're still achieving, they're still getting high grades. It's just taking them so much more effort to do that. How do we notice these girls? How do we help them get the help that they need?
I mean, what's really helpful is being able to pay attention to how even burned out these girls get and how exhausted they are, and even to what they're saying out loud. They might be like, oh, this homework is taking me forever. And maybe you might hear they're like, my friend, it only takes them an hour. So being really thoughtful and really perceptive of what's going on their day to day, and maybe sitting down with them and saying, hey, I know that it sounds like you're maybe struggling to get things done in a shorter time, maybe compared to your friends. I'm wondering if we can sit down together and create a plan so I can help you. And you let me know what's helpful. I don't want to feel like I'm telling you what to do, versus I want us to feel like we're creating this together. So you feel like you're not overwhelming yourself compared to your friends. I know that can be really tough, and you're doing a really great job. And we also don't want you to burn out. Because I know when we see kids doing really well, we're so proud of them, we praise them, and then she's like, oh my God, I have to keep doing this to achieve these high standards. Whereas if you start to recognizing she's burnt out, she's not sleeping, she's staying up super late to get these things done, starting to be perceptive of what's going on and being able to help her navigate that earlier on. Even doing check-ins with her, like at dinner time where it's super chill, like, oh, how's school going? Do you need any support? Because if you can just ask that, sometimes they're like, okay, my mom and dad think I should be able to do this on my own. Whereas, like, sometimes I struggle with this, and like it's can be hard to balance things at my job. Like I always like reach out to my friends when I need help, or maybe if my boss to create like a plan, which some of us do, right? Like, how do we create a plan to balance things? Because even having like a neurotypical mind, you still get overwhelmed. There's so many demands society placed on us. So if we're able to help girls navigate that earlier on, you can. And they don't even have to be diagnosed, say, fully with ADHD. Maybe something else is going on, right? You can still take the strategies that we discussed here and implement them at home. I mean, we can all benefit from some executive functioning skills, right? I feel like that's
Totally. Yes, exactly. And that was one of the comments that one of the participants made last time was, can we still use some of these strategies even for people who don't have ADHD? And absolutely, it helps. Like you said, everyone who has executive functioning issues can benefit from some more strategies, routines, structure, to-do lists, all of those sorts of things. When you were talking about the girls who are struggling really hard and then feeling like they keep having to measure up, but it's like really taking a toll on them. So many girls that we see for neuropsychs who are hearing the diagnosis for the first time are so relieved in a lot of ways to hear that there's a reason for why they're struggling, because up until this point they had created a narrative for themselves that they just must not be good enough, that
yeah.
they are they're dumber than their friends, or they're not working hard enough, or whatever it is. And so, when you were talking earlier about the comorbid anxiety and depression that often goes along with girls with ADHD and boys too, frankly, so many kids across both genders create this narrative for why they are not measuring up, and they don't understand that their brain, just like in that simulation, they don't understand that that's not the way that everybody else's brain is. um,
And sometimes
so yeah,
when
good.
kids take medication, one of the things, and even adults, sometimes I hear it's like, this is how a normal brain operates. Like they don't have so many things being thrown at them on a daily basis. And it's like, this is what it's like. It's like a
Yeah,
big aha moment for them.
yeah, I'm sure it's really a stark difference for them.
Yeah.
um, so one parent asked that she has trouble with a lot of visual noise at her home. And so she was saying she really wants to try and have her daughter keep a tidy and organized room. But is that really a fight that she should be fighting? Is that actually more shaming and overall negative for her daughter um, with ADHD?
Yeah, it is so shaming. I feel like we have well intentions that a clean space is a clean mind, right? But not for these girls with ADHD or kids with ADHD in general. It's so tough to clean a clean space. And it feels hard to put that demand on them when they're probably just like, I have so many things going on. There's so many things I need to do. And so with this, I say pick your battles. It might be they might have a clean desk one week, and in one week they might decide they want to make their bed. I think being able to be realistic about those demands are really helpful. It's always closing the door is always very helpful if it's something that might bother you. But being even setting with them and figuring out, okay, like what is helpful for a clean space for you? Do you feel better with a clean space, or do you actually know where everything is? And sometimes they do. It's their organized mess if you ever ask them. But realistically, it's probably going to go back to the same quote unquote mess at the end of the week. But if there is a way for you to sit with them, and again, that choice of giving them control of what that looks like, is it that their desk is clean and they at least put their laundry in the laundry basket, then maybe that's the compromise you work on. But figuring on, even if like a month-to-month basis, like what that looks like, but giving them the control too, because you don't want to see it as they're fighting back and they're like, oh, this is another demand that I have on my life, and this is so tough, and mom doesn't understand or dad doesn't understand what I'm going through.
That's a really good point. Another expectation on them. Um, let's talk about emotion dysregulation that comes up in ADHD. I think it's something that isn't always known because it's not one of the criteria in the DSM, but in the past it was. And so I think that a lot of the general public doesn't necessarily realize that being able to regulate your emotions is also really difficult for kids with ADHD. So one mom said that her older sister, so she has a daughter with inattentive type ADHD, and the older sister in the family is able to push her buttons very easily, even with minor comments. which completely disable her. And we know that having a very large emotional response is typical of ADHD, but the younger daughter says that she isn't able to not let it get to her. So, what are some strategies you might recommend?
Ooh, well, one, I think it would be helpful to talk to your sister and ways to navigate that because you're also showing, and if you can talk to your sister, one, about this, like, hey, there are certain things that you do might push her buttons. I wonder if we can decrease that. Is also showing your kids that you're advocating for them, that you're not just going to let someone push their buttons. But then we also want your daughter to learn emotional regulation skills too. So something that I recommend is A, therapy, and B, having a calming corner at home is really helpful. It's a space that I really think every family should have for their kids. It's a space where they can go and calm their bodies down, and that could be like with a weighted blanket, a weighted teddy bear, an emotion poster so they can tell you which emotion they're feeling. If they don't want to say it, they can point to it. And then a thermometer where they can also say where they are at that moment. And also a sheet of coping skills. I often share a feelings chart and a set of coping skills chart with families that they can put in the calming corner. And that looks like using a squishy, a needing a hug, a needing space. And so it gives them the option to choose what they need in that moment. So some families might include like fidgets in there, maybe putty, anything that they can do to kind of help them calm their bodies down. And then giving them about 5 minutes, like a timer almost, and going to check in with them and see if they want to talk about it. Because we want to give them, again, that control. Like they need a space to calm their bodies down, but also some control. I recommend mindfulness and some grounding exercises. There's like the five senses is a really good one. It's really distracting. It's like 5 things you see, 4 things you feel, 3 things you hear, 2 things you smell, and 1 thing you taste. It's how I start all my sessions with my kids, and they love it. It's really helpful. Like progressive muscle relaxation is really effective. So being lemon squeeze is a really good one. So pretending you have a lemon in your hand and squeezing out all the anger. So those are some tips and tricks I tend to teach kids. Um, and then another thing that I think is helpful is if they can start to notice the signals their bodies send to them in the moment. So if they're feeling angry and they notice that their heart's racing, they're getting really tense and their eyebrows are getting furrowed, like that's their body signaling that they're getting mad and they might react in a way that's not appropriate in that moment. Like we want to validate the feeling and we want to help them effectively and appropriately express that. And so if they notice that, then what they can do is some deep breathing, lemon squeeze, progressive muscle relaxation, and then like relaxing their body, visualization, like visualizing their happy place. So those are some techniques I tend to teach kids in session, and they're really helpful. Also, the simple one of walking away. Walking away is really helpful because it's less likely to engage in maybe a back and forth with your sister and her aunt. So it allows her to take time for herself. And that could be walking away to the common corner or walking away to her room and then coming back when she feels ready and calm to talk.
Awesome. Very good. And so those strategies are going to help with emotion dysregulation, but also with the behavioral dysregulation that sometimes goes with it. And sometimes the behavioral dysregulation isn't always just about emotional upheaval, but sometimes just that like physiological arousal that goes with hyperactivity and ADHD. One parent says that for girls who have more typically male ADHD with more hyperactivity and impulsivity without masking, how do you help them to understand context for their behavior? So, for example, it's great to be silly during recess, but not in class, and then preserve their confidence when they're getting a lot of negative feedback from adults and teachers. Sometimes she worries that her daughter's behavior is less tolerated because she's a girl, which makes her behavior feel even more unexpected.
Yeah, and I mentioned this when we did the talk. It's like teaching them if they like superheroes, it's the Peter Parker versus Spider-Man, which I find really
I
helpful.
love that.
It's like, when can I release my Spider-Man? That's like the fun, silly side. And you can use it for any character that they like, right? Fun and silly side of themselves. It's in the when they're out with their friends, when they're in recess, maybe even at lunch when they can just be themselves. And then more Peter Parker is like calm, reserved in the classroom. But I think what's also helpful is being able to educate the teachers as well to decrease the negative view that they have on your daughter. Because if they don't understand that she also has ADHD and she has these symptoms, and they're just going to treat her as a kid that's disobedient and just speaking out versus she's experiencing ADHD. So the way that her brain and her body works is very different. And so she needs added support. So can we get her to do something like jobs in the classroom? Is it standing up, handing out papers to her classmates? Is it being a teacher helper? Is it delivering things to the different offices? So that helps her build confidence in her abilities and helps her get some energy out. And also, decreases the chance that it increases the view of her compared to her peers and how she was reacting. So more a positive view, like, oh, she's a helper. Thank you so much for helping. She'll get positive praise and label praise for her efforts, which will start to hopefully decrease that maybe that internal dialogue where she's like, well, I'm a bad kid. The teachers only look at me as a bad kid. Whereas you're giving her some responsibility and you'll see it increase and like happiness and confidence in her. So it's like a double whammy, confidence and energy release, a movement break.
Mhm. Yeah, that context that adults see kids in is so important. And we see that a lot in our assessments and therapy, that when we communicate that information to other people who work with the kids, when there's all of a sudden this shift in how they're viewing the kids, no longer going from this, like, oh, it's just pushing my buttons, to this is a lagging skill or a weakness that is still under development.
Yeah.
It makes such a huge difference and really reduces the emotional temperature in the environment, so the kids can really start focusing on learning some of those skills without getting so emotional about what's happening to them because they can't control it and they feel bad about it. So totally agree. Um, one parent talked about her experience of how seeing this presentation the first time had her in tears because she felt like her daughter, who is now graduating from college, had a late diagnosis, and that early on she really thought that her daughter was lazy. They had a lot of fights. They had depression, anxiety, social media addiction, and that she went through therapists and no one ever suggested having her tested for ADHD. It wasn't until she almost dropped out of college in her first year that she figured something might be wrong, and that she feels really guilty for not having noticed it before. And, at first I just wanted to say that please, parents and especially moms, always take on that guilt for themselves, as if you should have a crystal ball and you should just know everything. So the fact that many mental health professionals worked with your daughter and also didn't see it, like that says a lot. Parents don't know everything that a psychologist knows, and if a psychologist isn't seeing it, like, clearly it was a hard to see, hard to notice problem. So please don't feel guilty. But I totally understand what that means, that if only kids had been noticed before, if only kids had gotten those services earlier. What do you say, Megan, especially to your families where you were doing your research and interviewing people and finding that a lot of their daughters of color were not recognized early on or were blamed for their problems? How did you help them?
Well, first, a lot of the parents shared, happened to be all moms that, like, thank you for providing a space for me to talk about this. Because one thing they didn't have was people and providers who were willing to sit with them and hear them out. They just were assuming the worst, like, oh, your daughter is just like lazy, unmotivated. And so they didn't have anyone that was like, hey, maybe something might be going on. And as you can see from the research, like, it's easy to blame yourself. And if you think about it, it was missed so much. Like, there's a lack of research conducted. A lot of providers didn't know this was something that was going on because these girls are working 10 times harder, but they're not seeing that. Like, oh, they're doing well in school. Like, they're just going through something right now. They'll get over it. It'll be fine. Right. And so they're missed. And so it makes sense why parents also might miss it, because they're not provided with the accurate information to be able to know that this might be something their girls are going through. And so a lot of times I sit with the families, I'm like, but you were able to get it. And I'm so sorry you had to wait this long to get that diagnosis. But don't blame yourself, because these providers should have helped you recognize it. And that's not okay, because it's easy, to see these girls in that light, that they're not motivated, they're not helping out, they're not presenting in these typical ADHD symptoms that we might see the hyperactivity, but they get missed. And so you did it. You got her diagnosed. You're able to get her the support now. And so that's what matters. Like, how can we move forward now? We can't live in the past, but like, how can we help her, support her now as much as we can, and let her know that you're there for her and how to support her in any way, whether that be like resources, support. Do you need me to go to the doctor's appointments with you, medication? Do you need me to get information for you? So showing her the support, because a lot of families didn't have this information. And so you're not the only one, to normalize it for you too, right? Because there's not a lot of information presented for girls with ADHD. And so my goal is to spread more awareness. And what's really great is that there are more resources being published now about it, which makes me so happy, because I feel like it'll help increase knowledge about girls with ADHD to figure out ways to support them and get them diagnosed earlier too.
I'm so happy you're doing it. Just a couple more questions. One parent asks, can we talk about social media and how it's so easy for ADHD teen girls to either use it as a distraction or even to become addicted? It's something that we've been hearing quite a lot from parents over the past couple of years, screen time addiction. Um, First, I wanted to just, a lot of parents don't realize that ADHD is not a disorder of not being able to pay attention. It is a disorder of not being able to regulate your attention in the ways that it should be regulated. So a non-ADHD brain can put attention as needed on a given topic, even when it is boring and unstimulating and not something they want to do. If they, have a chemistry test, they're not interested in chemistry, they really just need to get through, this lecture so that they can get the grade and move on. They can devote their energy and attention to that and just get through it. Whereas an ADHD brain cannot direct their attention appropriately to a boring thing. And so get super distracted, procrastinate on it, things like that. On the flip side, when something is very stimulating and interesting and they're very motivated to do it, they can put all their attention on it. We call it hyperfocus. And a lot of people with ADHD really like that hyperfocus because they can get so much done during that time and are, really effective during that time. But they might forget to go to the bathroom. They might forget to eat. They might not hear their name being called from across the room because literally 100% of their attention is focused on this one thing. So people with ADHD are often responding to cues in the environment for the external environment is doing the regulating of their attention for them. When something is very stimulating, like screens, social media, video games, it is drawing all their attention versus when something is really boring, they're not able to put their attention on it. So that's my lead up to this, because I think a lot of parents don't understand that qualification there. But now, Megan, with your experience working with, directly with kids, what do you say about screen time addictions and ADHD in girls?
I think you covered it, right? It's being able to understand. You covered it. It's great. Maybe some tips, but that's basically everything I would share. Because a lot of times you'll see on social media, it's like, it's not that I can't focus. I know what to focus on. And so oftentimes, for example, if what I've heard from like teens and older is like, I could be in class, but maybe if I'm planning something, I'm just going to sit in that class and plan all the things and get really distracted by it and not focus on school because I'm hyper focused on planning this trip. And so sometimes that can happen where they can be very focused. So with social media, you can sit and scroll and scroll and scroll. It doesn't help that these videos are very short. And so they keep your attention span for the amount of time that you need it to. And you can
And they just keep going. There's no end point.
No
You could
end
just
point.
keep doing it forever. Yep.
I like to call it a trap because you can get lost in social media. And so with that, I often suggest putting a time limit. I think anyone can use a time limit on social media, because if you start to see that, your stats on your iPhone might say like you've spent X amount of Z on this social media app, you're like, oh, maybe I should decrease that. So what's really great is that Instagram and all these other apps have a quiet mode where you don't get notifications and they go silent, which is very helpful. And also you can set timers on your phone where it gives you like a 5-minute like warning, like, hey, we're gonna have 5 minutes left on this. And so to decrease that and maybe even refocus their attention on something else that they might enjoy. So like getting them outside and not on their bed, just scrolling on their phones. But we also were just talking about this in our meeting with how social media impacts and like, is this just the way that they communicate these days? Like, is this something that we need to normalize? Something we'll talk more about eventually, but I think for now, being able to find limits to help even the kids get out and get about, walk around and just be in their environment, kind of like how it used to be. I think that could be helpful. I think any type of social media break is necessary so they don't get consumed in it and continuously going with the never ending scroll.
Oh, good. All right. So one last question. A lot of people, as they were registering for this talk, were asking, when is the right time to test for ADHD? So, for example, my daughter has one symptom, procrastination, none of the other symptoms. Do we test for ADHD? Or my 12-year-old is very scattered but does fine in school. Should I get her evaluated? Like, what do you think, Megan, is like the right time to take it up a notch, I guess, or like seek professional help?
Yeah, so I've talked to a lot of colleagues about this, and we've discussed that third grade around that time is when the demands increase. And so around that time, so elementary school around that time is when to start to maybe send out a questionnaire if possible, just to see, even talking to the teachers, I think that's going to be really helpful. Knowing the symptoms is the first part. Like, if you know what the symptoms are, then you can even start to ask questions like, is she daydreaming in class? Is she able to focus? Like, is her desk organized? What's her backpack like? Does she ever forget anything at school? And even like starting to keep note of those things for yourself. Because again, like we shared, like this can be a diagnosis of anxiety or something else versus or a learning disorder versus ADHD. So starting to pay attention to how the symptoms present and where they present. And yes, your daughter might be doing well in school, but we talked, like we shared, like masking is a huge part of it and working 10 times harder than their peers. So being really mindful and kind of checking in. So I guess around 7 or 8 and trying to like understand like when the demands are getting higher, can they handle it? Is it stressful? Are they staying up later than their peers? Are they able to focus when they're sitting down to do work? Are they easily distracted? Are they getting up? And so being able to be mindful of the criteria while also seeing how it affects them in school and seeing how it affects them socially and being able to understand that, then be like, I think I have some questions. Let me do a consultation call with Mandy and see.
Always happy to do that for sure.
Yeah. And
Yeah,
so
I think it really comes down to like that level of distress and impairment, right? So like a kid might be having particular symptoms, especially at home where they feel a little free, but maybe it's not actually causing them any distress or extra work or impairment in school and relationships. And so maybe that's okay for a while. They're just a kid who's always going to be a little bit messy or a little procrastinating, if that's a word, um, but isn't actually impairing their life. Versus some kids who might only have like a couple of the symptoms, but it's causing them a ton of distress, or like, they're having to spend hours and hours on getting things done at home. So your subjective experience of that and the kid's subjective experience of that is, I think, important. Um, yeah. Any last thoughts from you, Megan?
no, I think that's everything. It's been fun to present and get more questions this time around.
Yeah.
So
Yeah, same here. So thanks so much for sharing all of your experience and knowledge with us. Thanks to all of you for joining us for the second time. Please always feel free to reach out to Small Brooklyn for help as needed. Thanks as always to Park Slope Parents for helping us to share information, to support parents everywhere. Have a great rest of your day.